Other techniques that we might be able to supplement and provide some more relief when they go home are taping. So perhaps we just finally talk about those taping techniques and what you're trying to achieve with those.
Sure. So as part of this, as you mentioned, this pain management plan, we've delivered our manual therapy in the clinic. We've taught our patients how to apply it so that they can maximise their exercise productivity at home. And another supporting adjunct would be taping. And I think we've got a few taping options, but we're going to talk through two of them. So one is a spiral taping technique that simulates our lateral glide of the ulna. And the application of this, people get all worked up sometimes about applying a glide while you're taping. It's way too hard. A really effective strategy for applying this spiral taping technique is to position the patient in elbow flexion, so 60 degrees elbow flexion, in forearm supination. And then the tape, as you can see in the video, runs from the medial side distal to the elbow joint line to the lateral side proximal to the joint line, crossing the anterior elbow joint. And once you've applied this, to see if it's effective, when the patient goes into extension pronation, that tape should wind up. So once you've applied it, you put them into this position and you'll see the tape tighten as they go into that extended pronated position. And again, use a reassessment point once you've applied it. For example, pain-free grip strength. If it's effective, then you get an improvement in pain-free grip strength. The other taping technique that we can use is a diamond deload. So there's really good evidence in the literature that this is effective at reducing pain on palpation, so through pressure pain threshold, and also improving pain-free grip strength. And it involves the application of 4 strips of tape in a diamond pattern with the common extensor tendon, that lateral epicondyle, really at the center of that diamond. And the trick here is to pull the soft tissues, so the skin, underlying subcutaneous tissues, into the middle of that diamond while you apply each piece of tape. So you end up with this deloaded, puffy kind of soft tissue in the middle of that diamond deload once you've finished applying the tape. Do remember, of course, all of the precautions when you do tape. So clean the skin thoroughly before you apply the tape. Patients who are allergic to certain tapes, you need to be really careful with this. Use a hypoallergenic underlay first so that you can increase the longevity of the tape. It's not about the biomechanical effect. I think there's a few studies there that have shown it's really not about the mechanics. It's probably more about the sensory stimulus. So patients can get benefit and relief from this for taping techniques for several days after it's been taped. So as long as they're feeling comfortable and it's not irritating their skin, I will often leave it on for 3 or 4 days. If it becomes sensitive, take it off.
And it's really effective for night pain for those severe patients where they're not sleeping.
Yeah. Really good, and I guess that's the big thing. It's an analgesic effect, so it helps them with that pain sensitivity. Yeah.